Nobody thought the symptoms were serious, but now Chipo was fighting for her life. Chipo was a perfectly healthy 38-year-old, a wife, a mother of 3, a bank teller. Chipo never smoked, she rarely drank, and like many people, she believed that she felt well. There was no reason to see a doctor. Routine checkups were always something she planned to do later, but later never came. Recently, Chipo had noticed a small amount of bleeding that would happen when she was not on her periods. It happened once, no pain, just spotting. She blamed the stress because work had been busy and life had been hectic. The next time it happened, she barely even thought about it. But sometimes she would notice some bleeding even after sex. It felt strange, but she brushed it off. Weeks passed, and the spotting became more frequent. She also started to notice that she was feeling tired all the time, and by this time she had even lost a bit of weight. It must be the stress, she kept telling herself, but it wasn't stress. And now she was lying in a hospital bed receiving blood transfusion. The doctor had ordered some tests and the wait seemed endless. Finally, the results arrived. Dr. Tracy entered the room. The atmosphere immediately felt different. "Chipo," Dr. Tracy began gently. "The results have come back and you have cervical cancer." There was silence. Chipo was confused. "But how was this possible?" she asked. "I don't smoke, I don't drink, and nobody in my family has cancer." Dr. Tracy proceeded to explain that cervical cancer behaves differently from many other cancers. Almost all cervical cancers are linked to a virus called the human papillomavirus, or HPV. It's an extremely common virus. In fact, most sexually active people will be exposed to HPV at some point in their lives. But Chipo was still confused. "If it's so common, why doesn't everyone get cancer?" she asked. Dr. Tracy continued to explain that most people are able to clear the infection and it disappears naturally. But sometimes the virus can remain in the body for years, and over time it can slowly change the cells of the cervix and eventually become cancer. This process can take many years. And the difficult part is that these changes usually cause no symptoms at all. No pain, no bleeding, no warning signs, nothing. Just working in the background slowly. And that's why cervical cancer screening is so important. It's designed to find abnormal cells early before they become cancer. Chipo began to think about the years that had passed, the opportunities she had postponed, the routine checkups, and the screening she never scheduled. Dr. Tracy explained further that any woman with a cervix can develop cervical cancer, but the risk is higher in women with persistent HPV infection, women living with HIV, smokers, women who started sexual activity at a younger age, women with multiple sexual partners, and women who have never been screened. But the biggest risk factor in Chipo's case wasn't smoking. It wasn't alcohol. It wasn't a family history of cancer. The risk was not getting screened. And there is no worse feeling than knowing that you could have prevented something very easily. For years, the disease had been developing silently, long before the bleeding started, long before the weight loss, long before the hospital admission. The symptoms hadn't marked the beginning of the disease. They marked years of disease progression. But unfortunately, by the time Chipo arrived at the hospital, the cancer had already spread beyond the cervix. Treatment was still possible, but it would be more difficult, more intensive, and less effective than if the disease had been detected early, where a simple procedure could have been done to remove the cancer cells. Every year, thousands of women are diagnosed with cervical cancer. Many are diagnosed only after symptoms appear, yet cervical cancer remains one of the most preventable forms of cancer. through HPV vaccination, through regular screening, and through early treatment. The most important lesson from Chipo's story isn't about cancer, it's about timing. Because screening is not meant for women with symptoms, screening is meant for women who feel perfectly healthy. The best time to look for cervical cancer is before it causes a single symptom, before the bleeding starts, before the weight loss, before the hospital bed, before the diagnosis. Follow Consult Plus to stay informed and take charge of your health.